Welcome to Local Edition on Time Warner Cable. I'm Steve Swat with the Sacramento Report, and my guest this segment is Bill Monning, a member of the State Assembly from Carmel. Thanks very much for being with us.
Steve, thank you for the opportunity.
As we tape this interview, we are still awaiting the U.S. Supreme Court's decision on the federal Affordable Care Act. And yet, a number of states, including California, have been moving forward by enacting their own provisions, their own laws, that would sort of sustain at least part of the ACA. And I know you have a piece of legislation that deals with denying the right of insurers to deny insurance to those with pre-existing conditions.
That's right. So as you point out, Steve, we are on the verge of a very historic U.S. Supreme Court decision on the Affordable Care Act. We have in California moved forward to try to both put implementing legislation in place to implement the ACA, but also as standalone legislation to move California forward, really regardless of what the Supreme Court decides. And one of those areas that I'm working on is this issue of what we call guaranteed issue by insurance companies. In other words, they can't deny somebody for a pre-existing condition. The ACA extended that to young people up to age 18, and they further extended up to 26 being eligible under a parent's existing policy. Contemplated in the ACA 2014, that would extend to all eligibles, no denial for pre-existing condition. What my bill says, even if the court invalidates the ACA, that will be a principle of law in the state of California.
What then would be the rating factors?
Well, in essence, the rating factors, you would as a principle say no insurance company may deny coverage for a pre-existing condition. Then when you look at rating factors, we also address rating people based on certain demographics, certain age, certain constants, so that, in other words, an insurance company cannot prey on somebody with a pre-existing condition or a more complicated health care needs other than in those agreed to rating factors that will be applied across the board.
One of those is tobacco use, and that's kind of controversial, isn't it?
Right. Well, as part of the tobacco use rating, there are some incentives for wellness that would apply that are being discussed right now. I have other legislation that's trying to bring stakeholders to the table, from employers to healthcare providers to community advocates, and what are the best incentives to use in a workplace, and also make sure we avoid an unintended consequence of discriminating against somebody through no fault of their own. They have a genetic predisposition to some disease, socioeconomic. A single mom is taking the bus home after work to take care of kids and maybe can't go to the gym after work because of family responsibilities. So those are things we're looking at.
In an opposition letter to your bill, Blue Shield of California says premiums will skyrocket if carriers are forced to take the sick at any time without any encouragement to bring in the healthy.
Right. Well, fair enough as far as it goes. The Affordable Care Act, it's designed to expand access by expanding eligibility and broadening the risk pool. And in some senses, it'll be the medical insurance industry that are the big winners, because for many of those people, we're guaranteeing a pay source who haven't had access to the healthcare system, and yet they will be selecting among products on the exchange competitively.
Good point. Well, Bill Monning, thanks very much for coming by and talking about your legislation. It's fascinating. We'll certainly watch its progress in the months ahead.
Great. Thank you, Steve. Appreciate it.
And thanks to our viewers for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on My Government On Demand, also YouTube. I'm Steve Swat. Have a great day.